enter the room.
Hello, my name is Mishi Khan. I'm one of the doctors here in this department. Before we start, may I know your name, please?
Hello, doctor. My name is Kyla Masterson, and I'm
Is it
18 years old.
okay? It's nice to see you here. Is it okay if I call you Kayla?
Yes, doctor.
Okay, please tell me, how can I help you today?
Doctor, I have an embracing problem today.
I understand, Kayla, but can you please tell me more about it? I assure you that, whatever you tell me, it's going to be, kept confidential, so you don't have to be embarrassed about it. We deal with different patients with different types of concerns and try our best to help them. So there's nothing to be embarrassed about, okay?
Okay, doctor, thank you. I have this rash in my groin area.
Okay, I see. Can you please tell me more about it? How does it look?
It looks like clusters of red bumps and pimples.
Okay. And at what particular areas of your groin region is this rash covered?
No, it is more in my groin area. And
Okay. And is it okay?
yeah,
Is it anywhere else? Is only on over your groin area, or is it also spread to the other parts of your body?
not in any other part, only in my groin area.
Okay. And is it painful?
Uh, it is more itchy and burning.
Okay. And is there any bleeding or oozing?
No,
Any any whitish discharge?
uh, no, and there isn't any discharge.
Okay. And anything that makes it worse?
Uh, no,
Okay. And have you tried something to get relief from it?
uh, no, doctor.
And can you tell me, how did they start appearing? Like, did you have you had undergone any sort of procedure or something after that you might have noticed this appearance of the rash?
I used a Brazilian wax after that it started.
Okay. And did you follow the post care after the Brazilian wax?
No, after disappeared, I didn't continue using.
Okay. And do you have any long-term medical conditions, Kayla?
No,
Are you on any medications?
uh, no, doctor. I just take that uh, contraceptive pill.
Okay. Can you tell me what type of contraceptive pills you're taking?
That is the combined contraceptive pill.
And for how long have you been taking it?
Uh, I have been taking for the last year.
Okay. Do you have any allergies?
No, I do not.
Okay. I would like to know more about your sexual history. If and the questions are going to be a little intrusive and sensitive at any moment, if you feel uncomfortable, please do let me know. So, are you sexually active, Kayla?
Yes, doctor.
And do you follow safe sex practices, which involves using condoms?
Not really.
Okay. Have you or your partner have ever been diagnosed with any sexually transmitted infection?
Uh, no, not known.
Okay. And also, may I know how old your partner is?
He is my age, doctor.
Okay. May I know what you do for a living?
I'm a student at the university.
Okay. Have you traveled anywhere recently, Kayla?
No, I didn't, doctor.
Have you gone for any saunas or any swimming recently anywhere?
No, 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 doctor.
Okay, do you smoke cigarettes?
No, I don't.
Do you drink alcohol?
Sometimes, occasionally, doctor.
Okay, do you have any idea why you might be having these rashes around your groin region?
Is it an STI, doctor?
Okay, I will have a look and I will definitely, clear your concerns. And anything in particular that you're worried about?
I'm worried if it is contagious or something serious, doctor.
Okay, and what would you like me to do for you today?
I just want to know the cause and I want treatment for it.
Sure, Kayla. Thank you for having this discussion with me. I would now like to examine you. I would like to check on your observations and would like to have a look at the rash.
2 minutes
I would be
remaining.
doing it in the presence of a chaperone to maintain your privacy. So may I please go ahead?
Yes, doctor,
Okay.
thank you.
So based on a discussion and after examining you, it seems like you're having a condition called as folliculitis. Have you ever heard about it before?
No, what's that?
Okay, so folliculitis is the inflammation of the hair follicles. It's usually triggered after you get any sort of waxing or after shaving. So it is based. What happens is that in waxing it involves pulling out of the hair, and that can sometimes inflame the hair follicles, and they might get infected. So because of which you have been feeling you've been having these rashes. But don't worry, this will settle down within a couple of weeks. So there are certain advices that I would like to give you so that that can help you to get relief from it. So would you like me to go through one by one?
Yes, doctor, please.
So I would advise you to use a chlorhexidine skin wash. Use it at least 2 to 3 times every day. If it's causing you pain, you can apply some warm compression, or you can take some paracetamol medications as well. Try to keep the area clean and dry, and don't wear any tight underwears or tight clothes that can cause sweating and irritation. And so you can come back for a follow-up as well if you think that it's not if it's getting worse. I can offer you a leaflet so you can read and understand more about the condition. And in future, please to avoid get waxing done by a trained professional, and just try those methods which causes less irritation to
Move
your
on
hair
to the
and
next
follicles.
station.
All right, thank you so much. Thank you, Dr. Al, for the performance, and thank you, Dr. Mushi. All
Thank
right,
you, doctor.
thank you so much. All right, so that was great, Dr. Mushi. So, guys, what we are using right now to discuss these cases, this is something that we have built called the OSCE workbench, and we have put around 555 of the documentations in this app. And we have made it in such a way that you can practice with your partner. That's what we are doing right now. And if you don't have a partner, we have also incorporated an AI with whom you can also talk and practice the cases. Because ultimately, when you are preparing for PLAB 2, this is a practical exam, and the only way to actually get through this is by practicing. So do keep practicing and improve your conversational skills. So with the AI simulator, we try to simulate
Begin.
as close to the exam as possible. So you have a 1 minute, 1.5 minute of reading time, after which you will directly enter the room, or else you can click on this
Enter the room.
and you can enter the room where you will come face to face with your patient. So to start the conversation, you'll have to click on this microphone button, and then your consultation time is already started. Hi, my name is Dr. Anne. I'm one of the doctors from the GP surgery today. Am I talking to Kyla Masterson?
Yes, that's me.
It's nice to meet you, Kyla. Could you please confirm your age for me?
I'm 18 years old.
All right, Kyla. I can see from my notes that you have come here concerned about a rash. Could you tell me a little bit more about this?
Doctor, I have an embarrassing problem. I have a rash in my groin area.
I can completely understand, but don't worry. We'll try to help you to the best of our abilities. And to help me out a little, could you tell me a little bit more about this rash in your groin area?
It's like clusters of red bumps and pimples, and it's a bit itchy and burning.
All right, guys, so that is your patient simulator. So you can either go on for the 6 minutes, and once you're done, it will directly take you to the evaluation page, or else you can end your conversation where you will be again brought to the evaluation page. Over here, you can get an evaluation. So depending upon the conversation that you have had with the AI, the conversation goes into the evaluation, and the same checklist that you see for the practice gets populated according to how you have performed the case. So let's just wait for the evaluation. So from the evaluation, the marks are divided into data gathering, management, and interpersonal skills. And from the conversation that you have had, accordingly, you get scored. And so this is your patient GPT, guys. All your all your performance data gets stored in the form of time and date, as well as the entity that you've practiced with. So over here, since you've practiced with the AI, so you get a robot symbol. But if you had practiced with, a partner, then you would get a human silhouette. So that way you would be able to track how you have been performing over time. So this is the platform that we have built. We have a few cases for free that you guys can go ahead and check out. And if you are interested in purchasing in any of the products, we are offering a 20% discount, and we have posted the coupon code right there. So do use it and get your own patient GPT, guys. All right, so let's go on to the performance. Just give me a moment. I will just finish marking. All right, so let's take a look. So good job, Dr. Bishi, in identifying that this was folliculitis. So what were your other differentials that were going through your mind, like when you heard of the presenting symptoms?
Genital herpes and other STIs, if any. But the moment he said that, I got a Brazilian wax, it was very clear.
Yeah.
Yeah.
Yeah. That's right. Okay.
I was worried that I scored this less.
Yeah, so all the performances get stored. So depending upon, the time, I'm actually picking it out. All right, so yeah, let's quickly look at it. So patient identifiers, good job in identifying the full name and age, acknowledged potential, embarrassment. So whenever somebody is hesitating to, open up to you, the one way to actually start or get them in a more comfortable place is by explaining your role. Explaining, the purpose of, the visit. Say that, my role is to understand if there are any medical conditions that are worrying you, and I will try to the best of my abilities to help you, to overcome them, And we have seen a whole range of embarrassing situations. So please feel free, because anything you would say would be between you and my team until everyone is safe. Right, so that way, they have an idea that whatever they say is going to be in a confidential scenario, and the person that they're talking to is an experienced person who would be able to help them out with the condition. Right, so that's a good thing that you mentioned. So whenever you see or whenever you understand there is any hesitancy, try to explain your role. That's a good strategy to use. So good job on that. Ask about the rash onset. When did you first notice the rash, right? So that is one thing that you missed out. Right? So you did mention like you brought this back, you brought this about like quite later into the conversation. Like when did you first notice this rash? Like had you done anything when you noticed the rash? Right. So always start with your Socrates questions itself. To understand any causes behind why a rash could appear. So one thing that actually throws a lot of candidates off is because of the location of the rash. So most of the times, a lot of candidates get confused on, whether it is an STI or it could be anything else. So I think that's actually placed there on purpose to make sure to throw people off. So that's why I always try to explore Socrates to understand exactly where the concern is lying, right? Because embarrassing, that's also something that, you would mostly associate with an STI or other embarrassing issues, right? So definitely, try to understand the onset. Clarify exact site and number of lesion. Where exactly is the rash located? How many bumps can you see? Is there located in any other, region of your body? Because even when you're thinking about STI, that is a very good question to ask. Is it a single rash or a single painful or multiple painful? So, different conditions come with different presentations. So usually when you're thinking along the lines of syphilis, it's usually a single painless. Right, so actually understanding the number is also very important. And yes, review the past medical history and allergies. Do you have any long-term medical conditions or allergies? Are you taking any medications, right? ICE, good job on that. All right, partially covered. Inquire about aggravating or trigger factors. Did you come in contact with anybody with something, a similar rash? Any travel history? Travel history you asked. Have you started using any new soap products, bath products, or intimate wash recently? Right.
Okay.
Associated symptoms, local itchiness, systemic symptoms here. If it is something that is just a local infection, or is it something that could actually become a systemic infection, right? So try to understand a little bit about that. And also along with that, is there any burning, urination, any vaginal discharge? Because you're thinking along the lines of STI. So these are important questions to actually understand STI. PMAFTOs are partners, periods, past medical history, drug history, allergy history, psychosocial history. Examination, temperature, inspection of the rash, genital inspection, inguinal lymph nodes and examinations, right? Because that's how you're actually ruling out any STIs, because that is also the concern of this patient. This is the idea that she has. She thinks it's an STI. So you're actually asking questions to make sure to rule that out. Explore progression of the rash. Has the rash changed or spread since it started, right? Explore sexual history. So rule out any STIs. Are you sexually active? I think I'll give you a partial for this one. Any new partners? Do you use protection? You ask these questions, which are them. Systemic review, cardiovascular, respiratory, CNS, general gastrointestinal, genitourinary. So basically, you need to at least do the vitals to understand if it is actually systemic, or is it a local infection, right? Does she actually have fever or not, right? So don't go out. All right, management. Explain the diagnosis. Inform her that this is likely a superficial folliculitis caused by irritation from waxing, right? So what is the main thing that you actually have to say? Avoid waxing for a period of time, let your skin heal, right? And in the process, give medications to help that process go along, right? So you can give her medications. In this case, you will be giving her topical medications and you will be giving her supportive treatment. So mention it like that, because, you kept saying things one after the other, right? So you should do this, you should do that, you should do this. Categorize it into sections that you can talk about, right? So that it becomes into a conversation. So, you explain the diagnosis. After that, mention that we can give you some, solution or some creams that you can apply, to reduce the inflammation, right? Along with that, I'm going to give you some lifestyle measures that you can follow, right? And then start stating them out, right? And also I'm going to give you some tips to make sure that it doesn't get worse, right? Like don't wear any tight underwear and all that. Right, so suggest warm compression. So this is also supportive treatment, right? So this all comes under the category of supportive treatment. What all can you give as supportive treatment to reduce the distress, right? What all are the medications that you can give? So club it all together and mention it together. I'm going to be giving you medications. I'm going to be giving you some advice that can help improve the the symptoms that you have been experiencing. Right, and I'm going to give you some lifestyle advice so that this doesn't happen again, right? So preventing it from happening again, right? So mention it like that so that it becomes a little conversational, because towards management you end up talking a lot, right? So then it just becomes a one-sided conversation. Every time you're actually offering her something, you have to make sure that she approves of it. So it's always a conversation. So you're saying that this is something that we usually offer. Is that something that you would also like to have? Is that something that would work for you, right? So it should always be a conversation. It's not like I'm giving you this so you take it, right? So always have a conversation with the patient. All right, suggest warm compression 10 to 15 minutes 3 to 4 times a day to ease discomfort and help healing. Prescribe or advise OTC, topical antiseptics, chlorhexidine or fusidic acid if inflammation is mild. Leaflets and pamphlets, good job on adding that. Recommend keeping the area dry and clean, gently wash with mild soap twice daily, right? Safety netting and follow-up, seek. So that's if it gets worse. So, usually you use these words when you don't have time. So if you have time to explain, it will be great to actually tell her what to look out for. Right, safety netting and follow-up, seek help if it's painful, swollen or high temperature, consider bacterial testing if recurrent. Right, advise follow-up if symptoms worsen or recur. Clarify it's not STI, because that was her concern in the first place, right? So you've identified that she is concerned about an STI, so put her at ease, saying that this doesn't look like an STI, right? From your symptoms, it looks like something called folliculitis that could have happened after your Brazilian wax, right? Advise to stop shaving temporarily to allow the skin to heal. Prevent recurrence with aftercare. Recommend alcohol-free aftershave, exfoliation, and using salicylic acid post waxing. Counsel on shaving techniques. Shave in the direction of hair growth, using clean, sharp razors and moisturizing shaving products. Right. So those are the tips that you can actually give in addition. So there was one thing that you actually mentioned. After the Brazilian wax, you said, did you do the post-wax care? Like, what do you mean by the post-wax care?
It's like most of the time after, I don't know, I've read it in some notes that like after waxing, they give you some advices and tips to follow, give some ointments and something to apply, any gels. So did you follow their advice?
See,
If you're getting it done by a professional, then yes, they do offer post-wax care products.
So that's the thing that I'm trying to tell you. So ultimately, you don't know, right? What is the advice? You don't even know if it's supposed to be hygienic. You don't even know what the professionals do. So you have to give that advice. Did you do anything after the waxing? Did you apply anything? That's something you need to understand. What did she apply? What if she's actually allergic to the the ointment that they gave? So technically she did follow it, right? So this is very ambiguous. At this point, nothing makes sense. So if it doesn't make sense, don't include it into your consultation. So when you're actually asking questions, you have a reason behind asking questions. You're trying to find out what are the chemicals they use, what could be the cause, because this looks like it's very scripted. Right, so it actually looks like Brazilian waxes happen, and there is somewhere it's written some post-wax care. But what if the case would have been about something that she applied and she's allergic to that? So don't use very ambiguous terms like did you follow the post-wax advice. That's something that you can offer. Like the salicylic cream. To apply any antiseptics, especially aftershaves in the area, right? That is the advice that you can give, right? Or else in your question in data gathering, you can ask, whether she applied anything immediately after the wax, right? What did she do after the wax? Just to understand what was her habit after that particular, procedure, right? So that will give you a better idea of why this has happened. Otherwise, you're just assuming things, right? So you can't give that impression of assuming. So, as soon as you feel like it's ambiguous, don't include that into your data gathering. It'll be, it'll go wrong that way. Right? Instead, you can actually start giving her advice what to do after wax. Right? If this is not something that you're not following, this is something that you can do. Right? And talking about professional places for waxing, I mean, who could you call professional at this point? Right. In fact, you can just tell them if you are doing the wax, make sure to follow this procedure like post wax. Right.
Okay.
So yeah, don't leave it ambiguous. So that way you won't, you can't understand what is the root cause of what this condition could be. Right. All right. Interpersonal skills. Provide clear and simple explanation for diagnosis and management. Reassure about confidentiality. Everything we discuss and examine stays confidential. Acknowledge and validate patients' emotion. Address embarrassment and worry. Reassure, explaining that medical professionals deal with various health issues. Use open and closed questions effectively to gather information. Emphasize the importance of self-care and follow up if symptoms worsen or recur. All right, guys.
To practice this case with AI, please visit TuringMedSchool.com.